I am interviewing Christopher Goetz, who has been awarded the Stanley Fahn Lectureship for the 13th International Congress of Movement Disorders in Paris, France. Chris, first of all, let me congratulate you for an outstanding talk.
Thank you, Stan.
It was about the history of movement disorders in France, particularly the contributions by Professor Charcot. So I'd like to start with how you got involved in your interest in Dr. Charcot and the history, and then about the history of movement disorders in general, or reverse the order if you wish.
Well, I came to Paris in 1981 on a Fulbright senior research award and worked at the Collège de France, as you know. And during that time, while it was isolated in the laboratory, I was invited by the Agides at that time to come over to the Salpêtrière and to participate in a number of seminars. And it was all part of the Fulbright program. And while I was there, I was introduced to the librarian at the Charcot Library. Now, I had read about some of Charcot's works because I'm interested in just understanding the early descriptions of neurology and specifically Parkinson's disease at the time, but I hadn't really ever looked at any source documents. But I was able, through this kind of contact and personal introduction, to start to look at some of the Charcot manuscripts that at that time were just in boxes. There was nothing organized. They were just in cartons, tossed into a back room, and nothing was categorized by date or by diagnosis. And because I was here for a good while, when I was not in the laboratory, since I couldn't practice medicine in France, I would go to the library and I started to do some reading, and it became increasingly fascinating. It's very slow work. I mean, there's no doubt that you can't do this and get any accomplishment rapidly. But because of my interest in France, my interest in the French language, this became a kind of interesting endeavor. And it led to, I hope, some important contributions. And certainly there's been so much interest from my colleagues on this that I've been encouraged over and over again to continue to pursue it. So it's my love, but it's also the encouragement from my colleagues.
But did you have an interest in the history of neurology or movement disorders before you came to Paris?
Well, I guess I did peripherally. I mean, you know, I worked with Harold Clewans, who was a very well-read man and interested in historical topics of sorts. So, and I was brought up in a family where there was a lot of reading and a lot of love of books. But I think it really began when I came to France. Before that time, I read some, but not very much.
And since then, you have given many displays at various neurological meetings. I know I've attended those and read all the displays. They were very instructive and very interesting, the way they were presented. So you've continued your interest there.
Well, yeah, I have. I mean, the access to interesting visual materials, I think people really like that. And as movement disorder specialists, we are visual. So finding items that are, it's one thing to find a typed document that may be old and may be important, but it doesn't have any real appeal to people who aren't particularly interested in the topic. But there's a lot of material that's historically pertinent, that their drawings are interesting visually, and there are old films that can be had. It's just a matter of, you don't know when you're going to find something. And when you find something, you have to remember you have it. But then, if there's interest from a society or from the American Academy of Neurology of pulling these together to share, I have been encouraged in that, and that's been a lot of fun. It's a lot of work to do these things because there's nobody else helping you, but it has been interesting, and people appreciate it. But we're facing this with the American Academy of Neurology. We have these exhibits from the past, and the current executive board doesn't seem to be very motivated to bring them back. Costs a little bit of money to refurbish them, but I'm not sure whether we will reuse those in the future. So it may be a change in the times. I'm not sure.
And your work on Charcot led you to even write at least one book. I know I remember reading a book on the Tuesday lectures.
Right. I wrote a book. These Tuesday lessons are show and tell demonstrations where a patient sits right in front of Charcot. Charcot interviews the patient and then turns to the student audience and helps them understand what is the implication neurologically of the history of the patient. And they're delightful. It's theater because it's back and forth dialogue. And I chose 10 of these while I was in France to translate and then to write a commentary. And that was the first book. And then I wanted, and I felt I was equipped to write kind of definitive biography. So I worked with Oxford Press to develop a team to write a biography. But I realized early on that I am a neurologist. I mean, that's my skill. So I needed a French neurologist so I could gain access to the French libraries. And I needed a real historian to be able to have the legitimacy when our book appeared that the historians would pay attention to it. So our team was Chris, Michel Bonduel, and Toby Gelfand. And that book has been published, and I think it still stands as the major biography of Charcot, happily.
Is that written in French or in English?
There's a French edition. The original edition is in English and published by Oxford University Press, but then we regrouped, and Michel Bonduel negotiated with a French publisher to publish it in French, and so we changed the authorship around. So I think I took the last author role, and Michel and then Toby and then Chris are the authors of the French edition. It has a different title. It's exactly the same text. So.
Well, let's go back in time.
Oh, gosh.
How did you get interested in neurology, and then how did you get interested in movement disorder specific?
Well, I went to the University of Pennsylvania, and at that time, which was those years of Vietnam, the choices in sort of where one could go and be protected from being a soldier, medicine was a protected field. And I actually, in my last year of college, I worked in a psychiatric hospital called the Pennsylvania Institute. And I was just smitten with psychiatric disease. But when I got to medical school, I really liked neuropharmacology. And I had a seminar with Harold Klawans, who really became my primary mentor, and he was in his course talking about the very same things that I had been learning as a worker and reading on my own on schizophrenia and mood disorders and the chemistry of that, but he was talking about behavior and things that I could see. And I realized that what I liked to do was to look, not to just hear about behaviors, but to actually see behaviors. And what had fascinated me in psychiatry were the movements, the agitation, and the withdrawn behaviors more than the thinking behind it. And so I quickly saw that if I was going to go into this field of brain, I was going to be a better neurologist than a psychiatrist, which was, anybody who knows me would say, well, yeah, that's sort of obvious. But at the time, those two were not quite so distinct to me. So I worked with Harold. I asked Harold, I told him that I was kind of bored in medical school. I could learn these things, but nothing seemed to be very in-depth. It was all seemingly so superficial. And he said, come to work in my lab. I started working there. I was able to then present at meetings, and that's where I met you. And I still remember at a very early phase, I think maybe I'd finished medical school and was a resident, but I made a presentation, and you came up to me and said, that was a good presentation. Now, you won't remember that. No, of course you won't, because it wouldn't mean anything to be nice to a young person, but for a young person to be actually singled out and have something nice said by a mentor, it was all the encouragement I needed. So just talk about, well, how did you go there? Well, I largely went there because of wonderful people encouraging me.
So you went to medical school at Rush, and then you did your residency in neurology at Rush, but you also did a fellowship with Harold?
Well, there wasn't at that time fellowship. So I went off to France. I had, in my last year of residency training, I wrote what would now be considered a K Award application, And that was a training award for 5 years, of which 2, if I remember, had the obligation of going to another center. It was to train you to be a good academic neurologist and researcher, but at the same time to go beyond the myopia of where you were working. So the contract included leaving. And so for my application, I put in that I would like to learn more neurochemistry at the Collège de France and to work with Jacques Lewinsky. And so after my residency as a very junior faculty member, I actually left and went to France. And that's where this whole history thing started, along with meeting wonderful neurochemistry colleagues who still are friends. I mean, this is, these friendships have endured.
And then you went back to Russia. Your whole career has been really.
It really has. It really has. I think that for me, since most of my work is clinical research, having that stable patient population where I can watch things longitudinally has been very, very important to my own career. And then I think you know the Chicago group. We are very close. We are all pretty long-standing in one place. So.
And you took over from Harold Klawan's. I mean, you became the head of that unit. You developed the movement disorder unit,
right,
and expanded it, and have your own team now.
Correct.
Right.
Correct.
Very productive team, and I know
you've done
a lot of clinical trials because I see you involved in that, as well as your interest in psychiatric things. Maybe your interest in psychiatric background had led you to the interest of hallucinations in Parkinson's disease.
So. I think so, because I mean, I took this job, and I don't come from a medical background, so I had no discussions of medicine ever in my family, and that job in Philadelphia as just a youngster really enormously impressed me. I would come home kind of stirred and have to read about what these diseases were because I'd never seen anything like this. And the hallucinating patients, those with delusions, were stirred me. So there's no doubt that my interest in Lewy body dementia, hallucinations of Parkinson's disease, it goes way back. It goes way back. And the contrast, there's something about those. So now that the field is moving into this non-motor area of Parkinson's disease, it kind of sort of, I find myself, I've been on this road a long time now. It seems that other people are coming along and appreciating, which is very nice. But yeah, I think it does go back that far.
Another aspect of your work has been your interest in rating scales.
Yes.
You've also led the charge on that too. I mean, how did that develop?
Well, you know, you and I are pretty closely linked. I was always impressed after you led a team to develop the Unified Parkinson's Disease Rating Scale. I mean, you were the person who did this, and you did it and I was watching because I was young, as opposed to destroying and starting. You said, no, let's look at the best that's out there and cull it together, and in fact, not say this is the Stan Fahn scale, but that, no, this is the unified scale. And I can remember where the model that was, and you and I participated in this effort as well, of a Tourette syndrome scale, which was a disaster because we couldn't get everybody to be unified. The psychiatrists were on one side, and the decision was destroy everything and let's just ask 1 million questions and do a factor analysis. And of course, it never happened. And so I was watching. I was young, but I was watching that kind of effort of bringing people together and taking the best and then testing it is a very, very useful model to use. So I had, with my statistical background, I became interested in sort of what do we learn from these scales? How sound are they? Do they respond to therapy? And what happened with the Unified Parkinson's Disease Scale is it was developed and then we tested it. And when it came time to look at this, and I was asked by the president of the Movement Disorder Society to help critique some scales and to pull a team together, we identified our first project was the UPDRS, and our report was very laudatory, but because the field has progressed over time, There are a number of non-motor items that were not included, not because of any negligence, just because the field didn't really recognize them as pivotal. And there were other mild ambiguities, things that were not quite consistent from one part to the next. And so we had made the recommendation that this may be the time, and the science is there to back us up, to revise the scale. And so it is true that I led that effort, and that what we tried to do was not only build on the scale you and your team developed, but also to test it clinometrically before we actually unveiled it. And that took a long time, but we've done it, and we're proud of where we stand. And I'm just at this meeting, I've been talking to different groups about using the new version as a primary outcome. So I think we're going to see the natural and pleasant transition from an original scale and then a modification that's everybody recognizes is totally anchored in the original scale, but has some modifications that we hope will make a difference. So.
Well, congratulations on that.
Well,
that
you've been
work.
part of it. You're on the steering committee, so no, I think that's
Well, I want to make sure it gets recorded in
well,
history.
okay.
So,
it is history.
okay, so well, we covered a number of areas of interest in your work.
Yes.
Clinical trials, the psychiatric things, the non-motor things, rating scales. Are there other areas that in neurology or movement disorders I left out? I mean, first of all, I know you wrote a textbook, or you edited a textbook, a major textbook. So that's another challenging thing that you took for yourself.
It is, but again, I think that my work studying Charcot has influenced the way I do things in my own science, and that's Charcot. I'm not sure how inventive or creative he was, but he organized things very well, and he looked around the world and saw where the world was moving and tried to cull the very best in terms of the modern innovations and then brought them into his service. And I would never make a parallel between myself and the fame of Charcot, but I think I have learned some from him. I'm not so when you say, well, you did a textbook, but what I did was like Charcot, was I looked around the world, saw what's available as a textbook, and I saw a lot of good writing, but nothing that was homogeneous, so that you could, if you saw chapter 1, you could count on a similar treatment in chapter 2, similar treatment in chapter 3. So I gathered a group of people together and said, let's write a textbook where it's top of the line, but the reader can count on a similar organization, and you don't just write your own chapter. I'll actually write the template of what I want, and then you fill in the necessary paragraphs so we can cross all of neurology in a similar approach. And so I've organized that, kind of the way Charcot organized a section. But the real people who did the work are, of course, the brilliant the authors, and kind of the way Charcot had a section of this and a section of photography, a section of hydrotherapy, a section of neuropathology, really anchored with very, very smart people. And he organized it. I think that's so, it's not as if I've written a whole textbook, because I'm not that smart. Nor would I be interested in having that diffuse a specialty.
Another thing I know you've accomplished,
Yeah.
and that is being an editor. And you might tell us about that, how you first got involved.
Again, our careers are, I feel like I've lived my career somewhat watching you and following in footsteps as well as I can, but I have been the editor now for 7 years of the Movement Disorder Journal. You were the first Western Hemisphere editor, followed by Tony Lang, and now I am the third. And then there was a parallel group on the Eastern Hemisphere. And I have done that with Günter Deutschel, and I think of all the activities over my years, this has been the purest in terms of gratification, because so much of our work, I imagine, my work at least, is administrative. You're fighting with NIH, or you're fighting with your hospital for money and for prioritization, and you're not spending as much time as you want on the pure science. Being the editor of the journal is reading. You're reading what the cutting edge, what people think is the most important, and they're giving you their very best. And it's a privilege to read these manuscripts and then to ask your colleagues to peer review and have them say yes, that they're willing to do this, to see their reviews, to compare how they look at it versus how I look at it. It's a wonderful activity. And when I think back and say, Chris, why did you go into this career? I went into this career for things like this. And I don't have very many experiences like that anymore, because most things are colored somehow by the heaviness of administration and finances. And this has nothing to do with that. So ordinarily we take a 5-year stint and then we take another 5-year stint. But Gunter and I felt together that we've done as much as we can. As enjoyable and as wonderful as this job is, we've brought as much creativity as we have to. We've done and so it would be sort of on autopilot. And it's such a privilege to be the editor. We thought we should retire and let another group take over, and to leave the journal in absolutely tip-top order so that the new journal editors just walk in, take over, and we don't leave any kind of extra work for them to do because we were tired. We are not tired. We love our job, but it's time for us to retire. So that is something that's been special for me.
But this is not your first editing job. You had a previous...
No. Again, I was trained. I was the former editor of Clinical Neuropharmacology, which is a little journal next to movement disorders, but a good journal. And this had more to do with primary pharmacology and crossed, while there was an emphasis on movement disorders, also had psychiatry and had epilepsy coverage and a variety, because it was clinical and neuro and pharmacology. Yeah, I certainly held that post for a good while. And again, my history is linked to mentors, and Harold Klawans was the original editor and developed that with Raven Press. So, and now Peter LeWitt is the editor of that journal.
So you took over that journal from Harold Klawans?
I did.
I see.
did.
Okay. All right. So where do you think the field of movement disorders is heading? And what do you see the future?
Well, I think the area of the non-motor symptoms, I think, is a big area for the next tier of younger doctors. And there was a lot of discussion at this meeting about signs such as apathy, anxieties, things where we really don't understand the neurochemistry, we don't understand the anatomy of these elements that impact tremendously on the quality of life of our patients with Parkinsonism and the other movement disorders, not just exclusively. And I think that those areas are going to be increasingly the niches for our young people. I also think that I hope, I don't know that it will happen, but I hope that ataxia gains more attention. I think that this was an area that, at least in my training, we didn't really deal with. And the ataxias are now better defined genetically, but we still, in terms of neuropharmacology, know nothing. And I think that area at the molecular level and then the pharmacological molecular level, which would be these pharmacogenetic, genomic axes of research, I hope that becomes more emphasized, because these patients, we really don't have anything to offer them. So that's when I'm working with my younger colleagues, I am sort of encouraging that they think about these two areas. And then, of course, there are others, depending on what they're interested in. But I try to sort of steer them to, and certainly that's been re-emphasized at the meeting here, where that's where there are big lacunes.
Now, among all of your other duties, you also have a training program in movement disorders.
Yeah.
So, and when did you just take that over from Harold Klawans, or did you start it on your own? How did that go?
Well, I mean, Harold was older than I was, but he really had a different kind of organizational skill. And we were very harmonious, but very different. And Harold was able to think up a new idea. I mean, out of nowhere. You couldn't count on it, but if you were sensitive, it might come out, and if you could seize it. I'm more sort of predictable, maybe more mechanical, but impeccably reliable. And so it was very clear early on that in terms of running a section and developing a program, Harold was wonderful, but wasn't the person to do that kind of administrative work. And he would be the first to agree with me. I mean, it wouldn't be there was no power struggle ever. We were very close. So those kinds of administrative issues, while Harold was the senior, when it came to the kind of interviewing, deciding on candidates, developing curricula, all that was where my strength was. So, and then Harold died, so there was no even dichotomy here. So we have expanded the program sort of in the direction, always honoring Harold. In fact, we have in our conference room, we always have there's a portrait that has always stood there. And it's honors, and we discuss this often amongst the group because Cindy Camella works with me. She knew Harold well. Kathleen Shannon, Carly Tanner trained with us and worked with us for years. There isn't a time I see Carly. It's just, we have some little reminiscence about a time we had with Harold. So it's a vibrant recollection, although it is a recollection. Harold has died. Yeah.
Right. So he was one of your, not only a mentor, but one of your heroes in the sense.
Yeah, well, I think that there were three. And I think that's, I once, did a teaching tape about the UPDRS and wanted to say who would be the world experts, who would be the people to rate using this scale and be the world experts that with such impeccable credentials, no one would ever question these scores on this scale. And the people I chose were the people who influenced me the most. You, Harold, and David Marsden. Each of you having been tender to me and helped me when I was just so young. And I mean, it was that encouragement. Hopefully I was pretty good, but it was that encouragement that drove me to develop the ambition to be maybe as good. Not as good, but still in the same light.
So looking back on your career,
yeah.
If you, let's say 20 years ago, you're just starting out, let's say,
yeah.
Would you do anything different?
I think I chose well. What I didn't do was after my training grant, I did one more NIH application and was funded, but I was not bitten by the NIH kind of seduction of that one grant leads to another, leads to another, leads to another. And I think maybe from a strategic perspective, for continued NIH funding, that probably was an important step that I didn't do. So I've had intermittent NIH funding, but never that kind of continuity. But I think, of course, you have to bid in order to gain, and I didn't do that on a systematic way. I wasn't trained with that partly because we always had our foundation infrastructure. So I was never in that desperate situation of saying, I'll be fired if I don't get this NIH grant application. That might have been from a strategic perspective. Now it's all different because there's not that much money anyway. But I think if I were to do it again, I would have taken a bit more personal responsibility, even though nobody would have asked me, there would have been no pressure, that I would have insisted to myself that I always have at least one NIH application in the pot. And that I did not do. I don't know whether you would have advised it had you been my mentor, but I mean, I think that that's something, I know that's something I did not do.
You mentioned foundations. Now, you've worked with some. Could you tell us what they are and how do you work with them?
Well, when I started my career, the Chicago Center at Rush Presbyterian was the Center of Excellence for the United Parkinson Foundation. And this was, at that time, there were many small, and some large, but there were several foundations, and they were supported by patient donors. And the United Parkinson Foundation had one Center of Excellence in Chicago, and then had a scientific grant program where money was distributed across the country. And over time, Harold, as my mentor, and I very strongly really thought that there should be a single Parkinson Foundation. And I know Harold spoke with you, and I spoke with you, and eventually, and this was before Harold's death, the UPF, the United Parkinson Foundation, and the Parkinson Disease Foundation, which was traditionally anchored at Columbia, we merged. And we gave up our name of the UPF and became part of the PDF. And I can only say that tradition of having a center of research excellence that has an infrastructure of year in, year out support, that you can maintain your programs, that you can maintain your faculty, has been such an anchor of success. And it would be hard to imagine my career without having had that, because I look around and see my colleagues in a constant kind of scurrying, kind of desperate of this year this grant finishes, this year this grant finishes, and not having the stability to keep people in secure positions so they can think intellectually. And having that anchor, I can promise that there's been no laziness. It allows one to have the minimal amount to keep everything stable and to pursue then the grant applications that are necessary for the primary research. It's been very important. So, and again, you and I share in this because we are both Parkinson Disease Foundation recipients of Research Centers of Excellence. So, again, a link. Right?
Right. So how do you manage to keep your private life and your work life in harmony?
That's the hardest question of the day, and I'm not so sure I'm successful. And I think that balancing family and work has been the hardest challenge of my career. And what I did, realizing I have 3 children and I'm married, was that early in my career, and not always with a lot of encouragement, I decided that only on exception would I ever work on weekends. And you weren't too thrilled about this. You may not remember again, but that I would take the weekends, and that because I go to work, I don't have a study at home, I never take a computer home. When I go home and walk up on the front porch, my time is with my family. But I go in very early to work, I work long hours, but I keep the two separate. And so I decided that I would give my family the weekends and the evenings. But the scientific community didn't embrace this across the board. I mean, I think we've worked this out, but there have been conferences where people have said, well, we're meeting on Saturday, and really did expect me to come. And I've been pulled, and I've failed at some times where I've taken that weekend and gone to work and this and that. But I've tried to keep it very physically separate, because when I go home and the computer's there, I'm worried that I'll be tempted and go into it. And I've had the sense that my family deserves that total attention time. And we've worked it out, but it draws on me. I don't bring my family, for instance, here. I have no family here. Now, we used to live in France. There's every reason in the world that the family, but that's hard for me. So I told my family, no, we'll come at Christmas. We come at Christmas. If you want to come after the meeting, you're invited. But while I'm working here, it's hard for me. They can do it. I'm the one who suffers because I can't quite get the balance. I want to be at the meeting, but then I also want to go and do what they're doing, and that causes a problem. So I try to keep these things very, very separate. And I'm not so sure it's a good idea, but it's a solution that has worked for me.
Okay. And now, in terms of the Movement Disorder Society, of which you had many roles to play, including the editorship we talked about, and and now you gave the lectureship this meeting. How do you see it fits into the field of, has it done anything for the field of movement disorders or neurology in general?
Well, the Movement Disorders Society has done an enormous amount for movement disorders because it's brought together. Here we have at a meeting 5,000 people. And so having an excellent group and having an excellent congress on an annual basis and having an excellent journal certainly has brought up large numbers of young people interested in this area, and we've made enormous progress. I look around to the rest of neurology. I don't see therapeutic advances, anatomical advances of this ampler outside of movement disorders. I think what this is, so I see the society as having moved the field forward and certainly is known as the premier organization related to this area of neurology. So I think that's been a big, big success. No, I'm proud to be part of it. But you started it, so it's just, again, I'm taking on the second, maybe half generation down, but this was your idea.
And in terms of younger people coming into the field, and you see the field continuing to grow and advance, I take it? I do. And I see, I guess, what's been a privilege for me, and again, I've remembered you, is that there was an award ceremony yesterday. That was the topic here. But after my talk, there was a talk by a junior investigator. And it was a lovely talk. And it was so interesting to me because the topic she chose exactly came out of my talk. I mean, what the issue of multiple phenotypes with a single diagnosis or the complexity of diseases was exactly, had a historical anchor in the very talk that I had just given. And so after she gave it, and it was very high quality, I said to her, I said, that was a really, really nice talk. And she looked at me and was just beamed. And I thought, I probably beamed like this when Stan told me. And I remember this. I used to say, oh, this is just fiction, Chris. But I remember that you just told me that I did a good job. And it takes so little. And I'm conscious at the meetings here when I see a good poster, not to just say hello and thank you, but to say, you look like you're good. Because it can put a person on the path forever. It doesn't take very much. Of course, it has to be sincere, but so I see that in terms of the future, that it's our responsibility to pull those people forward. It's not as easy, I don't think, as it would have been for me, because there weren't that many people to say you're good to at my tier. It's probably why you could afford to stop me and say you were good. Because there were, our little tier was pretty small. Now you look at all these young people here. There are hundreds, maybe thousands. So it's the pyramid is differently structured. It's true. My group was a smaller, all trained by 3 people in the world. So it's yeah. Now your entire career has been in academic neurology. The other choice in the United States, I guess, is going to practice, see a lot of patients, and get some satisfaction from that. Have you ever decided at one point or other that maybe you chose wrong, or you did choose right all along? Have any regrets?
I guess what I think there are more choices. For me, there wasn't even that choice. I don't come from a medical family, so I never knew what a family doctor did. I never saw anything like that. So it was, I really only thought about modeling myself after the people I saw during school, which was an academic environment. It's true that patient care is important to me from a research perspective, but it would not satisfy me long term to do that exclusively. And I don't have I like to spend the time to listen to what's going on with the patient, and I like to think about it. And I don't think that the current private practice opportunities allow for the necessary time to reflect. I may be wrong because I've never done it. But, you know, there are a lot of other choices. There's industry now. There's going and being an employee of a foundation. There are, and what was evident to me early in my career, and I imagine for you too, was it was a one-way street. If you went out into practice from academics, there was no re-entry. If you went and joined a pharmaceutical firm, forget it. There was no academic post for you. But I see it's slightly different now. I see people sort of floating in and out. It's much more nebulous. I don't know whether it's good or bad, but it doesn't seem quite as one way as at least I envisioned, and therefore I stayed on my path. But my path has included leaving the States and working in France, going from clinical research into basic science research, and then coming back to clinical research. So there have been some of this variance, but it all has been under the umbrella of academic life, thank goodness, yeah.
Did you feel that there were barriers in your path that you had to overcome, or was it all nice and smooth?
It was pretty nice and smooth. I mean, I think that's I can remember, this didn't have to do with medicine, but my life has been kind of smooth. I come from a relatively privileged background, but I can remember my father telling me, he says, you know, because you've had opportunities, the bar is higher. You have to expect more of yourself because you haven't had to work. And so you need to put your time into being the very, very best you can. Don't loiter if you have a little extra time. So I haven't run into conflicts, but I have felt for myself the pressure of you have to be very, very good. That's not okay to be mediocre. It's not even okay to be good. So, but those are my pressures, all right? Nobody else has put those barriers on. No.
Well, you obviously achieved a lot.
I did.
You reached the big award of the Movement Disorder Society. And we all congratulate you. It was an excellent lecture.
Thank you.
And I enjoyed interviewing you today.
All right. Well, it's a pleasure. It seems like it should be the reverse, my friend, but I'm honored that you took the time to ask these questions. So thanks, Stan.